For 3 years, after I almost lost my legs due to amputation, I had to take care of my open surgical wounds alone. I had to clean them, dry them, dress them, take care of them completely. I had to look at them often, as that will ensure that if anything's going on, I've got them ready and checked already. It's a gruesome, painful, and bloody mess, but I guarantee you in the long run, if you do it, you'll be much more thankful because you'll be happier that they're clean. So today, I'm going to teach you how to properly clean and dress a surgical wound. And we're going to start with cleaning and removing the old dressing, caring for the skin and incision, and then we're going to finalize it all up with dressing the incision. So when first attempting to dress and to clean, you need to be prepared with a sterile surgical or sterile environment. We want to make sure that everything is clean. Pretty much. Your bed sheets, your towels, anything you're using has to be clean and sterile. That's to prevent infection. There are 3 types of infection. There's bacterial, fungal, and viral. Your bacterial is the biggest one we're going to worry about because that's going to be more of a staph infection on the skin or inside the wound. Fungal is going to be more of your hand, foot, and mouth disease or thrush. And a viral infection is going to be more along the lines of measles or chicken pox. So now that we know we have to have that area clean, first thing you do is wash your hands, dry them. 30 seconds is what's recommended. Just scrub with some hand soap, 30 seconds, you're good to go. Dry them with a dry towel. And then we can work on removing that tape and the gauze. So Lynn P.B. Taylor's Handbook of Nursing Skills recommends that we always keep, when removing the dressing, the area wet. The reason for doing that is the tape adheres quite nicely to skin, and removing that can be painful, especially around an incision, which I guarantee you hurts a lot. So to make sure that's good, we just, on your incision, you put a cloth or a gauze that's wet, and you just moisten that area to keep it wet. If it's still not coming up, just make sure you do it some more. Something that I found that was very helpful was adding vinegar to the wetness of the cloth. Just put a little vinegar in your saline solution or your water. It actually helps numb the pain a little bit more. So now that we've got the bandage off, we're going to take that bandage and we're going to throw it in the garbage. We don't want it anywhere near us because it's going to have old blood or pus or some sort of something that we don't want infecting our skin again. And we're going to discard it. We're going to make sure we wash our hands again to make sure the infection does not continue. So now that we've got the sterile area and we have the dressing removed, we're going to take care of our skin properly and clean it. To do that, we need gauze, syringes, antibacterial cleansers, and there is a question on that. Antiseptics on Wounds by Andrew Sal, MD, states that an antiseptic is an agent that destroys or inhibits the growth and development of microorganisms in the living tissue. So she's obviously against using antiseptics, things such as like alcohol or sterile cloths, things that she would suggest would be more like irrigating the incision with saline solution through your syringe. So once we've got that area cleaned and irrigated, we're going to move on to watching for the infection. Things that we look for are any drainage, any hot area next to the wound, or any swelling. Those are big things. Now we have to redress the incision, and Surgical Wound Care, Changing the Dressing on WebMD, states that to use an antibiotic ointment, if your doctor prescribes an antibiotic ointment, apply it as exactly as instructed, and this may help prevent infection and reduce the size of the scar by keeping any heavy scabs from forming. So he's obviously antibiotic is better, whereas Andrew Sal was against it. So I would follow your doctor's wishes on that, and just do as he says. So we take the gauze, we take the tape, and we dress that wound. Make sure that the gauze fits the wound. Obviously, you don't want to take a big piece of gauze for a little wound. And we use that tape just to adhere it. So now that we've gone over how to prepare the area and properly clean and redress your surgical wound, we're going to always make sure you pay attention to the telltale signs of infection and notify your doctor if you see them. If you think you might have one or you're ready to, then notify the doctor, obviously. So you're now ready to take care of your next wound, and hopefully it won't be yours. Any questions?
What's a good example of antibacterial ointment?
Antibacterial ointment or an antibiotic ointment?
Antibiotic, sorry.
Antibiotic ointments. Any good antibiotic ointment would be prescribed usually by your doctor, and that would be a prescription-based kind of thing. An antibacterial ointment, there's a difference between the antibiotic ointment and the antibacterial. So antibacterial ointment is going to be more of like your Neosporins, which you would put just on a little scrape. Any other questions?
Where's the best place to get the supplies, such as syringes and the gauze pads?
A lot of pharmacies. So places to get syringes and the gauze, obviously would be something like your local pharmacy. They're going to have it. Some actually, like Hibiclens, which is a cleaner, you have to have prescribed by a doctor. From when I last used it, we did anyway. I don't know if you can get it over the counter now or not, but anything like that would be at your local store, Walmart, or pharmacy. Any other questions? Okay, well, thank you.